Thank you very much, and I'm really looking forward to this panel, and thank you for the opportunity to participate and learn from this committee. So our topic is harmonizing with other national metric sets, and I was reflecting back on my time in the federal government where harmonization was the name of the game for almost everything, especially aligning ways in which to assess and monitor clinical research and many other things. So many ways, our own committee, our HHS Advisory Committee, did its own version of a harmonization type exercise when we developed the framework. We were trying to at least get our mindset and our values together in order to make sure that we could have a foundation from which to work. So the members of the panel that we will have today are also well experienced in harmonization. They've created and they've led established and respected critical resources and tools that routinely inform diverse audiences, stimulate discussions and actions, and continually evolve based on the changing needs of the population and their audiences. So before we start in my introductions of each of the panel members, I wanted to also mention a few things that have been themes today already in the morning, and I just wanted to highlight them as they became really themes within our own committee. So first of all, one of the things as highlighted in our leading health indicator report that we believe it's important for selected leading health indicators to be understandable and resonate with a diverse set of stakeholders and stakeholders that can drive action. And so the importance of broad stakeholder engagement was part and parcel of all of our discussions from the beginning all the way through and continue on. Ideally, we wanted stakeholders to be there from the very inception of Healthy People 2030, but we realized that connecting and enticing and seducing stakeholders from all sectors takes time and also communication. So some of our earliest recommendations that sort of opened this door was the importance of social determinants of health and health equity as cross-cutting themes. And we recommended that stakeholder engagement include more than structured public comment periods for testimony or written comment. And we recommended adopting a health in all policies approach, not a surprise, and identifying sectors for inclusion in the process. So we itemized as many sectors as we could think, and we developed templates for communicating to those sectors what's of value to them, what's the value of what they themselves have developed that would be useful for health and well-being. And we hope that that type of exchange continues and really builds. We also, within our overarching goals, really highlighted the stakeholder aspect by adding a new overarching goal that we didn't have in previous iterations of Healthy People, engaging leadership, key constituents in the public across multiple sectors to take action and design policies. So the second point really has been made well this morning and will continue on with this panel, which is the importance and need for community data and having it linked to the national or vice versa, having national link to the community level. This importance has been part of our thinking of where does the action take place and what kind of information and data could be used at that ground roots level. And so one of our components of our plan of action is that we need information so we can address regions and populations with poor health and or at-risk support programs and inform policies. And thirdly, Ed had made the comment about our discussions on data partnership infrastructure. And we are still deliberating on this particular aspect, but we realize, and I have been I'm of the 1979 cohort, very excited when the Surgeon General's report came out. So I've watched Healthy People and participated in Healthy People unfold over the decades. But the issue that is before us now is the data that are evolving. The information and data we need for health and well-being is emerging all around us and through initiatives and private sector and other nonprofits that is really important and useful to communities. And so we can't say enough about what those data partnerships would look like, but we realize they will bring in innovation. They will create at most a umbrella structure, and we would learn together, we'd be able to communicate, and we could also work to inform not only 2030 as it evolves, but also 2040. So we're very much looking towards that type of effort. So let me move to our wonderful panel and say a few comments about each of them. Tom Eckstein is the founder and principal of Arundel Metrics, and I went on the landing page of your firm and I loved it. Both plain language and an image. He has this focus of making complex concepts simple and understandable. And we, in the public health arena, have lived long and well with America's health rankings that are now in its complete 30th year. So thank you, Tom. And then Kristen Lewis is the director and co-founder of Measure of America, a project of Social Science Research Council. And I love what Measure of America has done and continues to do, but I also, Kristen, love that you have done reports for states and gone into individual jurisdictions and given us the depth of information that covers all of these multiple levels. And finally, Marjorie Givens is the associate scientist with the University of Wisconsin Population Health Institute and is the deputy director of data and science with the County Health Rankings and Roadmaps program. And the county rankings were built on what Wisconsin had started and done so well, and were able to be ramped up for the nation. So we look forward to that presentation. And I think we'll start in this order. If we start with you, Tom, and then move to Kristen, and then to Marjorie.